Welcome back to part 2. Kyeyongerera ddala mu maaso. Abantu abasinga mugamba nze nateekayo implant okuva olwo sina feeling ya musajja n'emu nzenna n'enkala era yansuula eddalu. Those are some of the things we're going to be discussing. Don't go away. So someone watching would want to know, what are the most effective methods of family planning? Because you know, women, we talk a lot. So when you find a friend and they tell you, hey, me, I'm using the Cooper IUD, and someone tells you I'm using the implant, you go, hey, I'm also going to go and put that. What would you advise? What are the most effective?
The most effective family planning method is one which is 99%. Yeah, it gives you a 99% contraceptive effect. And I'd be proud to say the Cooper IUD.
The Cooper IUD.
Yes, is the most effective, seconded by the hormonal IUD. Yes. And why am I saying that? It's because we are seeing a high turn-up of women embracing the Cooper IUD, despite the side effects and what others have gone through, maybe not good experience.
Yes.
There's a very big turn-up of women using the Cooper IUD. And also new clients are embracing the hormonal IUD.
Okay.
So those two, yes,
are the most effective.
Yes, they
are. What are some of the good things that come with the Cooper IUD, and what are the side effects? What should someone expect? Because I'm sure after this show, everyone is going to run to hospital to get the Cooper IUD. So they need to understand how it works, how it's inserted, and yeah.
Okay. The Cooper IUD, the fact that it's non-hormonal contraception, people are running away from anything hormonal, anything artificial. So with that kind of, like, I don't want anything hormonal, I want to go the non-hormonal way.
Yes.
So
to avoid the weight gain, the mood swings.
Yeah, all that that comes with the hormonal contraception. The Copper IUD, yes, and I would like to show it to you.
Yes,
how
please.
It looks like, because I know some of our viewers, I know majority have the Copper IUD.
But there are those who don't know.
Those who have it and it's working well for you. Thumbs up, keep on, preach the gospel, bring in more people. And for those who it's not really working well for them, trust me, if you visit the hospital, visit us, we have a conversation. Try and understand what are you going through, and we can always advise and see what else maybe can work for you. Okay. So the Copper IUD, I'll briefly, maybe they'll zoom in and they'll see it. Looks like this. Okay, there are different types, but I've come with the T-shaped. Okay, it has this copper part of it. That's why it's called the Copper IUD, because this brown thing is the copper part of it.
Okay,
and this we insert it in the uterus. Okay. We put it in the womb, and it's just a demonstration kit. So when we insert it in the uterus, it stays like this, okay? And its function is the copper. The copper itself weakens the sperms, okay? And through that, because of course during sexual intercourse, the sperms will come through the vaginal wall, they go through the cervix, and then they occlude here as they are trying to look for the ovum, on either on the right or the left tube.
Okay.
So this copper element in it weakens the sperms, and they are not able to swim well and meet any of this. That's how it works. But the most important thing is making sure it's in the right position. Okay. So
because they usually get dislocated.
Yeah, they do. But what happens is that, like I mentioned earlier, during the counseling session, when we are talking about this Copper IUD, we emphasize that this method, you're going to use it, it's in your uterus, it's in the womb. You need to have regular checkups.
Okay.
Okay?
Check.
Yes, to see that, to make sure that it's in the right position. Of course, when you come to us, we are trained health professionals, we have been doing this.
Okay.
But that doesn't mean that when you put it, you're good. Okay? We assure you this method is in the right position, but you need to really come back. After your first period, we need you back. Why? Because it tends to give majority of the clients a heavier, longer menstrual period.
Okay.
So the heavier menstrual period, which your uterus is not used to, just because of this foreign body, the copper and the IUD, the foreign body itself, the flow is heavy, and somehow it can sweep the IUD during your period. Like the bleeding is really heavy, and it can sweep this IUD. You may notice it, you may feel it, you may see it coming out, or you may not even know that the IUD is out. So it requires you to
keep going to hospital
yeah,
for checkup.
you need to at least return after your first period.
Okay.
After your first period. There are those people who actually don't even get that heavy period. And there are those who have just normal flow. It's not heavy, it's the same. But there are those also who have a heavier one. So we need you back after insertion.
But men don't like that IUD because it keeps scratching them.
What happens is that these are the IUD strings.
Okay.
And these IUD strings, you see they are long. And this is the vaginal area.
Yes.
Of course, during sexual intercourse, these strings are long, you will feel them. But even if you touch, this string is very soft.
Oh, this shouldn't be a problem.
Yeah,
really.
It is very short. But what happens is that once you insert this IUD, we cut it shorter. We don't leave it like that. We cut it like 1 to 2 centimeters. And then we curve it around the cervix. Okay? So it's folded. And it stays there, because when you want this IUD out, these are the strings we hold and we pull it out, and it comes out. Okay. But for those clients who have that issue, the partner is complaining that it's really hurting or he feels it's not comfortable, we always tell you to come back and we shorten it further. Okay. We have a way that we just curve it around the cervix and we leave it there.
Okay.
Yeah. So that's how it works.
Okay. What about the hormonal IUD? How does it work?
The hormonal IUD, it's let me just try and open this. This is the brand we have. So the hormonal IUD, I think I can open it. Sorry. It's the opposite of the copper. Okay? The hormonal IUD, it's like, you remember how I said that it's a drug?
Yes.
Yeah, so this is it. This whitish thing is like powder. It's the hormone. Okay? So it goes still in the uterus. The method of insertion is the same. The strings are quite longer, but they're also very soft, but we shorten them still. But this, once you put it in the uterus, unlike the copper, which releases the copper chemical part of it, this gets absorbed along the lining of the uterus. This drug, it gets released and absorbs the endometrial lining. So it somehow becomes thick. And again, this drug thickens the cervical mucus. The cervical mucus is that it's like a plug, like a blockage around the cervix. So during sexual intercourse, the sperms will come and they will not go beyond the cervix to enter the uterus, because this drug has caused the cervix to, like that mucus is thick, the sperms cannot go through the uterus. But this, it just uses the drug and it acts direct, and it's hormonal.
Okay. What are some of the effects, the side effects of this?
Well, this, before you have this IUD inserted, even the copper IUD, you need to, go through some screening, some tests that we do. One, we rule out infections.
Okay.
Because it's not advisable, especially for the two, to have a pelvic infection. The vaginal discharge, the itching, and what. One, you have to rule out infections. Two, we do an ultrasound scan. Some clients have, for example, fibroids. Some clients have some bleeding in there. So we need to be keen before inserting these methods. Okay. And those are the key investigations that we do. Any abnormal uterine bleeding, we have to understand why are you bleeding before we introduce this method. Even the copper IUD, but most especially pregnancy. It's our key thing to make sure that
you're not pregnant as you're inserting it.
And we're inserting it, because that's how the complications start happening. A pregnancy gets stuck in the tube, you start bleeding, thinking it's the copper IUD making you bleed, yet you're already having a miscarriage because there's a pregnancy. So we go through those screenings before we introduce this method. And that is the information we try to make you understand before you accept to have either. That you understand that the copper IUD will give you a bit of heavy flow, but don't bleed for a month. You don't say
And
bleed
keep
for a month,
quiet,
and keep
yes.
quiet. Remember, you need to come back after 3 weeks. And also, it's good to have a contact of your provider.
Okay.
Give a call. I'm going through ABCD. We're able to guide you.
Yeah, most of you complain that these IUDs give you infections. So sometimes you understand that maybe you insert them when you already have an infection in there. That's why they disturb you. But also one thing to note is when you're using these IUDs, you have to make sure that you have only one sexual partner. Otherwise, infections are going to become your friend. Anyway, thank you for watching the Diane Show. We are coming back in part 3 and it's going to be our final part.